I can hear. If your doctor has ever removed a big hunk of earwax from your ear, I know it's gross, you might have noticed afterwards that you were like, oh my gosh, I can hear. This happens to people of all ages with earwax removal. I've done plenty of videos on earwax removal, by the way, because it's a really important topic. Earwax can actually cause hearing loss, and it's actually one of the common causes of hearing loss. We are talking about 7 common causes of hearing loss. That is one. The second one would be loud noises. This is huge. Guys, these are my earbuds. You might have headphones, earbuds, like whatever you're using to listen to music or what have you. I always say, when you've got your earbuds or whatever in there, if somebody outside of you can actually hear what you're listening to, the volume is probably too loud and what you're listening, like on your headphones or earbuds. So keep that in mind. But it's not just that. It's like going to concerts and listening to like your favorite band with loud noises. It could be at work, occupational exposures. Maybe you work with a jackhammer or loud equipment or explosives or gunshots or any of that kind of stuff. Guys, I say make sure you're using and wearing your personal protective equipment that you're given at work. Do not blow that off. That is so important. Loud noises can be an important and very common cause of hearing loss. All right. Number 3 is sudden pressure changes. You guys might have experienced this. Sudden pressure changes caused by either head injury or flying or even scuba diving. I've had actually a few patients over the years where they've actually had injury to their head. Either somebody hit them very hard near their ear or what have you, and the pressure difference caused them to lose hearing. It's actually not small. It's actually a big deal. But it can happen in other instances I mentioned with flying, with scuba diving and other things. So pressure changes can be a big one. Number 4 is frequent ear infections, right? So things that happen with your ear. So if you have frequent ear infections, it could actually cause hearing loss over time. Some people have chronic fluid behind their eardrum because of like allergies or what have you. That can actually cause hearing loss as well. And then there are other sort of infections and things that can cause you to have hearing loss, whether maybe you had meningitis at one point, maybe you had measles or chickenpox. Remember, one of the reasons why we like to prevent a lot of those diseases is not just because of the obvious things we think about. A lot of these conditions that can affect the nerves can also affect hearing in some people and in some children and adults. So keep that in mind. Number 5, let's see here. Hearing loss at birth, right? We know that a number of people have hearing loss at birth. That is a cause of hearing loss. And by the way, I should say 1 in 8 Americans, on a separate note, have hearing loss in both ears. Hearing loss is the 3rd most common condition in the United States after arthritis, believe it or not, and heart disease. Okay, we just got a couple more. Number 6, medications. Yeah. One of the things I definitely remember in med school is learning about certain medications that are what we call ototoxic. That means they are toxic to the ears. It can actually cause hearing loss. So it's very important. Some medications actually can do this. If you have questions about your medications, make sure you ask your doctor. And I would say one of the definitive most common causes of hearing loss is simply aging. That's right. As we get older, for a number of different reasons, hearing loss becomes more prevalent, and aging is a big part of that. So if you feel like you are losing your hearing, this is the thing. Signs that you might be losing your hearing: if you're turning the TV up too loud, if you find yourself shouting, or you find yourself asking people, wait, can you say that again? I didn't hear you, things like that. Or if you notice that in a partner or a family member, get your ears checked out. Go to an audiologist, go to your doctor, get a hearing test, see a specialist, guys. This is super important. I'm Dr. Jen Caudle. I'm a practicing family physician and on-air health expert and video creator. I do daily health videos, as you guys know. If you've not liked and followed my page, I invite you to do so. And for those of you who send stars, I respond to you personally. And consider joining my subscription group called Dr. Jen Superstars. Guys, I'm Dr. Jen. I'll see you soon.